Historically, clubfoot treatment has evolved right from Hippocrates' times. Hippocrates also felt that clubfoot can be molded like wax and corrected to have a normal looking foot for the child. Those days there was no plaster of Paris. They used to do the corrections with linen bandage soaked in egg to stiffen it and then use it to manipulate the child's foot. Over the years, centuries down the line, plaster of Paris was discussed and described. Wrenches to correct the deformities by using lever arm techniques like wrenches have also been used. The whole 30s, 40s, 50s and 60s were the period when Kite's methodology for correcting clubfoot deformity by plaster manipulation was described and became popular. However, the 70s saw the evolution of the surgical treatment for clubfoot. Turcot's method in Europe, Cincinnati's method in US were the most common surgical techniques. They were described, published, and they took over like a storm across US and Europe and rest of the world. The early results were excellent. However, a review of long-term results clearly shows that many of these feet become stiff, have worse deformities over a period of time. Ponseti, on the other hand, started his technique way back in the 40s, post-war US, in a small agricultural university town of Iowa. He did his research work based on what Robert Jones described as a simple method by manipulation to be able to correct all children with clubfoot. However, Robert Jones never described the technique, so Ponseti was curious to know how is he able to correct. That forced him to go back into history and read whatever was available on clubfoot. The pathoanatomy, the anatomy, the kinematics that contribute to the deformity. He dissected stillborn babies with clubfoot to understand what is the pathology. And based on his studies, he felt that the best method of treating clubfoot is to undo the kinematic deformity that is happening in a child with clubfoot. The treatment by Ponseti's method has two phases. One is the corrective phase, which has the manipulation and the casting, followed by a small tenotomy. The other is a maintenance phase. It is not that the corrective phase is important and the maintenance phase is not important. Both are equally important. If you do the corrective phase and do not follow up with the maintenance phase, these feet go back into deformities. So it's important to recognize and counsel the parents on the importance of both the techniques. That is why we have counselors, because the children need to be followed up on a long term. Not just cast, correct and forget. No, they needed to be followed up by counselors. That is why we have a 24/7 helpline. We have a follow-up up to at least the age of the child when he is 5 or so. So that's the key message that we have, that the method has corrective and maintenance phases. How is this technique different from the other techniques? It has manipulation based on the kinematics of the foot, and that is the key to understanding this deformity. Correction by Ponseti's method. Ponseti, when he described this method, he had not validated it by any technology. It is only long-term follow-ups which happened over a period of time by his fellows, which showed the results were excellent. So today, Ponseti's methodology has been validated by 30-year follow-up of patients treated by him, validated by magnetic resonance imaging of the feet before and after correction, validated by clinical evaluation and follow-up by comparative studies of results of children with clubfoot treated by surgical intervention and clubfoot treated without surgery using Ponseti's method. While it is easy and efficient and effective and economical, it is important to recognize the fact that there are certain details to it. It is a specific method of casting after a specific method of manipulation, followed by a specific method of tenotomy, a specific method of bracing, and a specific method of follow-up of these children. And in the end, if the patient has a recurrence, a specific method of managing that recurrence. So there is a detail to it that is important to follow. They say the devil is in the detail. We say the God is in the detail.